Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, videos, review books, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, you guys, I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, with a 99% pass rate on our comprehensive review and a 100% pass rate on our one on one sessions. I always like to start with a disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see, I have created and designed for you guys as a tool and resource to assist you with preparing for boards, but they're based off of the guidelines that are currently being tested on the ANCC as well as AANP exam. Now, anytime that I am doing videos to strictly teach you on what we are doing currently in practice, I will always say that so that there's no confusion, okay? So, with that being said, let's get into the questions for today. All right, you guys. So I wanted to do some farm questions for you. Like I said, I'll be throwing more of these in because a lot of you reach out to me about assisting with pharmacology. So we'll merge this in to help you as well. Okay. So the question states the nurse practitioner and NP student are discussing ACE inhibitors. All are contraindications of ACE inhibitors except is it A, hyperkalemia, B, hypovolemia, C, heart failure, or D, pregnancy? Take a moment and tell me what you got in the comments. All right, you guys. So, I always tell y'all to read the stem of the question first. Stem of the question being that typically the very last sentence, but the one with the question mark, the actual question, right? Because this allows you to slow down and ensure you're answering what they're even asking, like really focusing in on what they ask. So you're not rushing through, skimming through, and missing key points or answering a question that, we have created in our own storyline. So here the stem states all are contraindications of ACE inhibitors except, right? Paying attention to not, except, things like that. And so except is telling us we're looking for the one that is incorrect, right? So what are contraindications of ACE inhibitors? Is hyperkalemia a contraindication? Yes, it is. You don't want to give ACE inhibitors to people who have hyperkalemia because it can cause us to hold on to the potassium, right? It has that potential of the elevation of your potassium levels. So, of course, knowing this, we're not going to give it to you if you are already hyperkalemic, right? So, A is correct. B, hypovolemia. No, you don't want to give it to people who have a history of hypovolemia or currently have hypovolemia. C, heart failure. Now, that's your answer because we know we do use ACE inhibitors with heart failure, right? And then D, pregnancy. You don't want to give it with pregnancy, more so in the second and third trimesters. You want to be sure to not because it can cause deficits with the fetus. So A, B, and C, A, B, and D are correct. Hyperkalemia, hypovolemia, pregnancy are all contraindications for ACE inhibitors. We also know if they have an allergy to ACE inhibitors, if they've had angioedema, you don't want to give it. If they have a cough, you want to stop it. We know all of those things, but I wanted to give you some more information in the event that you may see questions with this, okay? All right, question number 2. The nurse practitioner and NP student are discussing Accutane for acne management. All of the following are requirements prior to prescribing Accutane except A, wait 30 days, B, take 2 pregnancy tests over a 30-day span, C, 2 forms of birth control, or D, A1C. And y'all, I did it again. I have C on here twice, but you know what I mean. So tell me what you got in the comments, you guys. Tell me what you got. Tell me what you have. All right, so stem of the question states all of the following are requirements prior to prescribing Accutane, except. All right, so which one is incorrect, right? So do we wait 30 days before prescribing Accutane? Yes, we do. So before that prescription can be given to them, you want to wait 30 days, and I'll go further as that. B, you take 2 pregnancy tests over a 30-day span. Yes, we do that. And that also includes why we wait the 30 days because we want to do an initial pregnancy test. And then at the end of the 30 days or somewhere closer to the end, you want to do another one. Um, C, 2 forms of birth control. Yes, we want to make sure you're taking 2 forms of birth control. Accutane is very detrimental to the fetus. So, and you can see how severe it can be, can lead to fetal death. Think about that. That's why we want you to have 2 pregnancy tests over a 30-day period to ensure you're not pregnant, and also have you taken 2 forms of birth control for that full 30 days as well. And that's why we wait 30 days. Now, although we do need to watch cholesterol levels, liver function tests before prescribing as well, A1C is not one of those requirements prior to being able to start taking Accutane. Okay. So A, B, and C are all correct when you're thinking about prerequisites of Accutane prescription, okay? And then the last question for today, a mother returns to the office with her daughter today with complaints of continued ear pain and fever. The patient was treated for acute otitis media 14 days ago with amoxicillin. Based on these findings, what is the next best treatment option? Is it A, azithromycin, B, augmentin, C, ciprofloxacin, or D, provide symptomatic management? Take a moment and tell me what you got. Tell me what you got. All right, you guys. So, stem of the question states based on these findings, what is the next best treatment option? All right. So, I tell you, if they're asking for treatment, you need to run it back and see what the diagnosis is. Look and see if they've provided a diagnosis. If they have not, then you want to take it a step further and look at the assessment findings so that we can come up with a differential diagnosis because we can't treat something that we don't know what it is, right? So here they have already told us that 14 days ago, the daughter was diagnosed with acute otitis media, right? So we're painting the picture. They're in the office, mama's in here with her little girl. Baby had acute otitis media, treated her with amoxicillin. 14 days later, baby's still having issues, right? She's still having that earache. She still has a fever. So clearly, we probably still have this ear infection, right? So I want you to think of second line therapies. And when you're studying, I want you to process through these things. So, I always tell y'all, think of the A's. My Brittany's brilliance for acute otitis media is think of the A's. Acute otitis media starts with the A. That's one A. Our next A is our first line therapy, which is amoxicillin, another A, right? But we've already utilized that. Second line therapy is augmentin. You want to give the augmentin when that amoxicillin did not work within a 30-day span. So if you have utilized amoxicillin within the past 30 days, you go to the augmentin, right? So that's our second line therapy. Now, if they have a penicillin allergy or we've utilized these two without resolve, azithromycin, our last A, is the third line therapy, okay? But we're not to third line. We are at second line. We have started with amoxicillin. It's 14 days later, 2 weeks into this therapy. She's completed it. She's not having any resolve. We want to bump up to our second line therapy of augmentin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure you meet me back here. And if you have any questions you would like me to cover, put them in the comments. I'm happy to create questions to help you with areas that you may struggle. If you need any other resources, I offer quite a few things. With my review book, you can see both of those linked into the bio of this channel. It's the ebook option as well as the paperback, whichever you prefer. It is color. It is in color, and it is broken down because I have images, especially for the dermatology section, so that you can see it along with the information provided and details on it. It's broken down by system. It also has interactive sections by system in the format of our that I always encourage you to study and learn on, because that's how we practice and treat and document in the assessment, diagnosis, evaluation, and treatment format. Also, it has practice questions at the end. So ebook option or paperback, both linked in the bio of this channel. Also, the self-paced review course that is an independent study broken down by systems designed for family and adult Gero for the ANCC as well as AANP exam. Also is linked in the bio of this channel. The group course is our 5-week review course. Next one starts on June the 10th. And then lastly, one-on-one sessions, which are customized based off of your needs. Sometimes reviewers need something just simply, hey, I'm struggling with asthma, and you want sessions to help with that. Or sometimes it's like, hey, I was unsuccessful on boards. Can you assist me to being successful? And, wanting to review for a 4-week period. And then I design a custom plan and package for you. We assess where your weaknesses are initially, and then we work through each system together with one-on-one sessions, with assignments, with my study resources and tools to get you from unsuccessful to successful. So if you need any of those things or just confused on what you may need, just give us a call at 803 400 6864. You can also text this number or shoot us an email at the nursing studio, the number one at gmail.com. But make sure you meet me back here. Happy studying. Bye, y'all.